Good morning. This is Erin with the Department of Medicaid. It's not quite 8:30 and we're still clearing out the waiting room, so we'll give it just a moment before we get started.
Thank you, Aaron. Apologize for sending you the wrong agenda and appreciate you getting it correct so fast.
I try to get it out as quickly as I could, so hopefully it's been received.
Yeah.
I believe Emily sent an email she was going to be unable to join us.
That is correct.
Okay.
I see Linda's on here and Cresta, and I guess we're waiting on Renee.
It's just now, excuse me, it's just now 8:30 and there's still some people trickling in, so we'll give it just a moment. The waiting room is cleared. I still don't see Renee, so we can give it a moment longer, or if you want me to just keep an eye out for her and let you know when she arrives, we can do that, whichever you prefer.
Yeah, we can go ahead and get started. Short here if you'll keep an eye for it. We have 3 members on, so we're good. So the first thing on the agenda would be to, excuse me, to review and approve the May 14 minutes.
Dale, we're going to need one more. You have 6. We only have 3, so you have to have 4 of the 6.
Gotcha.
As soon as someone else joins, so I will let you know. I scrolled through just to make sure I didn't miss any TAC members, but I think so far you guys are the only 3 on.
I'm gonna text her, Dale, and see.
Renee is logging in now.
Thank you.
Sorry, Dale.
That's okay. Glad you made it.
Yeah, I'm still dropping off kids, but I was like, oh, it is already 8:30. I apologize, guys.
No problem. I guess we can review and approve the May 14th minutes. I've read them and we have a motion to approve those.
I'll make a motion.
We have a vote on approving those. Chris, Fred, and Renee, and Linda.
Yes.
Yes.
Okay, welcome everyone. And it's a rainy day where I'm at and probably where you're at as well. We have one item on old business and it's been on there for several meetings. Do we have any information on the study findings to increase the PT, OT, and speech fee schedule? Do we have Justin on here? Do you have anything to add to that?
Good morning. No, we don't have any update on that at this time.
Okay, on to new business. This first concern is with the United Healthcare issue that Krista brought to my attention. Would you like to address that, Krista?
Yeah, so we got sort of it figured out, but I don't know if anybody else is having this issue or not, but when you submit the claim, there was, I guess, normally we would choose the option to put the provider's name on the claim, but then when we asked, United Healthcare about it, because they were getting kickback, if it was a different provider than what was on the auth. So like if a therapist was out on vacation or whatever, sick, what have you, another therapist was seeing the kid, but because that therapist wasn't on the auth, they were kicking him back. So they said we could actually put the clinic name on the claim instead. So I guess so far that's been working okay, but I think maybe there's sometimes when that's not an option to put a clinic name, and then I guess then it's like, then what do we do? So I don't know if there's a solution. I was just kind of wondering if that was happening to other people and kind of go from there.
Has anyone else experienced that?
I mean,
Hey,
it's-
Marshall, have you seen anything like that?
We haven't, but we're facility.
No, I haven't seen anything, Dale.
Yeah. So we'll just keep on keeping on, and then hopefully it won't be an issue. And yeah. And I think I already got the answer to number 2, so we're good.
This is Greg from United Healthcare. I just wanted to make sure you have my contact information in case you have other issues. So I'll put it in the chat just to make sure you have a point of contact.
Perfect. Thank you so much.
For sure.
Thank you, Greg.
Dale, what I can comment about UHC for us is the problem, and this has been happening for years, because anytime a clinic that has behavioral health, they can't keep our providers in network. They keep getting kicked out of network. So we have this constant problem of claims processing out of network. And it's a little confusing because it is mixed up with commercial and Medicaid. You know what I mean? It's both. And so it's a chronic problem that they cannot keep the providers in network because they keep clicking over to the behavioral health side, and then they'll say, oh, those people are not in network.
Do you have some examples of that one?
Oh, we've got plenty. We've gone up the chain. I can get that to you if you want to put your email in the chat.
For sure.
All right, the next thing on the agenda is also an issue with Optum, and Cresta brought this to my attention as well.
I think we got that resolved, Dale. Or I got an answer, so it's fine. Thank you.
Okay. And the third item on new business is the therapy diagnosis codes that will bypass prior authorization that the cabinet is suggesting. And I received those about a month ago and sent them all out to the TAC for any contributions that they would like to request on maybe other diagnosis codes or these ones in particular. I think it's a good idea to have these codes bypass prior authorization.
Dale, is that for all payers, or that's only the fee for service?
I believe it'd be for all payers.
Okay, who's overseeing that, I guess? Is that somebody from DMS or?
It is. This is Justin Derringer. So this is a proposal that we put forth, and it would be for all payers. But we wanted the tax input and review before we move forward with implementing such policies.
Okay. Appreciate you asking for our input.
Were there any codes that the TAC would like to add to this list?
Dale, it's Pam. We might need time just to look at that and see if they're, is it possible to submit them by a certain date, like in a week or 10 days?
Yeah, we don't have if you all need a couple weeks to review that, that's no problem. We don't have a set timeline, so we wanted to work with you all on this list, and we're still working with other stakeholders on the list as well. So we don't have a firm timeline. We want to make sure we get it right before we implement this policy change.
Okay, that was the last item on new business. I think Pam had a couple questions. Pam Marshall had a couple questions about OT and PT students billing under their supervisor. You want to address that?
Yeah, I'm here. Yes, the question, and Justin, this may be if you can get a written answer for us, because I was speaking to the policy division and was told that OT and PT could not, I brought up the question about a temporary license, because both OT and PT, when they're in school as students before they walk across the stage and get their diploma, they have student experiences. When an OT goes after they graduate, they have 2, 3 month or 12-week rotations that they have to do. And typically it's one-on-one. So the supervisor is always with them. And they gradually take over, treating that supervisor's caseload with the supervisor there, signing off on all their documentation. And the whole state does this. And as we had it writing from Medicaid a while ago, that yes, you can bill students under their supervisor because the supervisor is really the one responsible for that treatment. It's not like a CODA or a PTA that is off treating by themselves, treating on their own. And so we were getting clarity then when an OT and PT has graduated, and OTs now have the option to take their exams prior to graduation. PT is not. They have to graduate and wait, and their exams are only given, it's something like every other month, so it's not, the timing doesn't even work out. They have to wait a couple months until they can take their exam. And then they have to submit once they get that passing, they have to submit to the board and get their full license. Well, during that time period, and there's each provider, like it would be great if Medicaid would do this for every provider type, because even on the behavioral health side, there's supervision that needs to happen before that person can be fully licensed. That there should be a provision, Medicaid should allow for a provision for students to go all the way through their education and become a fully licensed provider. There should be a way to allow that person to transition to a fully licensed provider without having to not stop seeing Medicaid patients. Does that make sense? It's kind of what we did for CF, how there was a 5-year-old regulation that would not allow a speech language pathologist when they graduated from their master's program. They had 9 months or 10 months, however long it took, to get through all of the requirements to become a fully licensed. But they operated like a full therapist. They just have supervision and have things they have to complete during that period to get their to get their C's is what we call it. But and in the state of Kentucky, that wasn't allowed, and we worked on that and worked on that. That otherwise, what happens is if you don't allow it, all the Kentucky higher education programs that we love and support that are producing these licensed clinicians, they'll have to leave our state, and if they leave our state to go work, we're probably not going to get them back. Like that's a very bad thing. We have to be able to align the policy so that these students can become fully licensed and treat along that journey. Does that make sense? So we were asking policy question how this came up. Can a temporary licensed PT, because they're waiting to become fully licensed, can they be billed under their supervisor as is a student? Because technically they're still a student, they're not fully licensed. And we were verbally told, no, you can't do that. That's not in regulation. And I said, what? Now the whole state is out of compliance because we all take students. And I realize we don't normally take temporary licensed. We normally just take students that aren't licensed at all that are billed. So we just need that clarified and need that the whole state needs that direction. And if anyone would like to add to that, any of the other therapy.
Are you talking temporary permit? Or are you talking about an actual student doing their level 2s?
I'm talking about both. We're wanting clarity on both because I was verbally told that we couldn't. Now we can't have students billing under their supervisor, and I just said that is new news to me. I have not heard that.
I know with CMS, I said for Medicare, I said, a student can treat, but it's almost like the therapist cannot be doing anything else. They have to be like guiding everything in the treatment session. They can't do it any independently. It sounds like you are with them anyway, so it should be okay.
Yes. But if you here's the problem. When a PT is finished with school, most of them have big school loans. So if they cannot be employed if Medicaid's saying you have a temporary license, you can't bill Medicaid. So now you're limiting all these students that just got done cannot work any, they have to only work at a facility like a hospital or a home health agency. So now a majority of the jobs are not available to them if they cannot come work like in an outpatient setting and be billed under their supervisor, have supervision. But they would have to begin to have their own caseload, meaning that supervisor is supervising with them and working with them. But there's times they're not in line of sight. They're in the same building, but they might not be line of sight for everything. So that's the clarity we want. And for the profession, because, higher education, we've demanded bigger and bigger degrees. So they're coming out with very large student loans, and those student loans kick in immediately. So these students have to work. They can't, although nationally they can't, it might take them 3 or 4 months. So just like the CF, there's kind of a limit of how long you can, right? You can bill that person as a CF. They can't forever be billed that way. They have to eventually get their full license. That we're asking for clarity on that. And will Medicaid make allowances when, like OT and PT? We've also asked about behavioral analysts because they have the same problem. We have, there is provision for mental health therapists. When they come out, they're considered an A, like an LPCA or a LM or L or a M. I'm saying that wrong. LMFTA. No, I'm not saying that right. But a licensed marriage family therapist is also an A. And it takes them 1 to 2 years to get all that supervision requirement to become a fully licensed standalone therapist and take their boards and pass them. So we're asking for Medicaid to look at a provision for this transitionary period. It's a typical transitionary period that we're asking for clarity on.
And they have actually obtained the temporary permit from the state licensure board, correct?
Yes, that's my understanding.
Yes, they have obtained the temporary licensure.
How do other states do it?
They bill under their supervisor.
Yeah, they allow it.
Yes,
You mentioned this. I'm sorry.
Go ahead. I was just say, because all their notes are co-signed by the supervising therapist. That's part of the temporary permit regulations.
Right.
Yep.
Yes,
Yeah.
that's correct. So that supervisor is taking on not the liability, but it is sort of like they're saying, I'm reading what they're doing. I'm looking, I'm helping them understand what they're doing. And I'm saying, this is correct, essentially. But the off and the billing, what has to be on the claim is the fully licensed supervisor. And this is common practice. On the commercial side, they allow it. It's the Medicaid side that isn't set up clearly. The rules are not clear. There are people doing it. Like, for example, I know this is therapy tax, so we're not talking about behavioral health, but on the behavioral health side, there's lots of people advertising for temporary licensed behavior analysts because there's so few of them. So they'll hire the TLBAs, they're called, or temporary licensed behavior analysts. But Medicaid is saying, no, that's not allowed. You can't bill Medicaid for that. But yet there's a slew of people out of compliance because they're hiring those people because it takes them so long to get their required supervision hours. They have to work under a supervisor while they're working in order to get to the fully licensed status. Do you see what I mean? That's what the requirement is, but the Medicaid regulations don't align with it. So it's an alignment problem. We have to align policy to what the education and licensure requirements are for each of these types of therapists.
Is that Linda, is that or Justin, is that legislation or is that under this?
Yeah, so it's not legislation, it's regulation, and we can definitely take a look at that. I think it's something good for us to look at. It is correct that they cannot, a student or temporary license cannot review or bill work themselves at this point. So you would have to be actually with them performing the work while they watched or something kind of like that in order to bill currently. So to do what you're asking would be a change to administrative regulation and policy, and we can definitely look into that. So if you will.
And Justin,
yeah.
and just to clarify, I don't think Pam, with the two things, there's a student and then temporary. I think the students, we agree, need to be under and all times with their supervisor if we're billing. That,
Sure. Yeah.
we agree with that.
Yeah.
It's the
Yeah.
temporary
Correct.
license.
Yeah. So
Correct.
we can open a study and take care of that. And if you want to put that as an item on the next TAC agenda, we can give you an update, let you know where we're at and how that's coming along if you want to do that.
Justin, another question about this. So is there a way at least to send Dale an email that says we confirm that OT and PT students can be billed under their supervisor? Simply because I was just told that verbally that no, you can't. And, we've all done this. We all take students, we all bill them under the supervisor. They are being supervised. It's not like the student has their own caseload and the supervisor has their own caseload. They only have one caseload. They only have the supervisor's caseload, and the student has a process of coming in and slowly taking over some of those cases with the supervisor in the session or in line of sight. They're with them during this process.
You keep saying student. So is this a student or is it like a PT that has graduated and is just...
No, this is a student that hasn't graduated. So I was verbally told that the student could not be billed under their supervisor. And I just said, what? So I want to see that in writing because we are rule followers.
So Pam, I'm a little confused, I guess. So maybe we can,
yeah.
I may need some more clarification.
Yeah.
So maybe we can set up a meeting offline and discuss a little bit.
It is basically two issues. One,
Sure.
a student.
One's temporary, one student. And
yes.
I guess my confusion is you're wanting to bill for the student, but if they're under if there's a licensed clinician that's actually doing the work there with the student, that's who you'd bill for. So I'm not sure how
exactly
you bill for the student, but we can talk about it more.
We don't bill for the student. It's under the supervisor. But I was verbally told you can't do that. And that's why I'm saying, what? We want clarity. We've all been billing under the supervisor, and we just want clarity in writing that, yes, that's the correct way to do it. When you have a student, you bill under the supervisor, and, we know all the line of sight and, being the supervisor is with them, but the student may be the one treating with the supervisor with them. Does that make sense? Because the whole goal is they're learning how to treat. And then the second issue is the temporary license. So when they're done, can we not hire these temporary licensed therapists for a certain amount of time to be billed under a supervisor? But the temporary license would be like the CF, where they have their own caseload and they're allowed to get started working, but it's only for a period of time. Then they need to be fully licensed. You can't go on forever like that. You have to pass your boards and get fully licensed.
So we're still seeing the issue, that number 2 issue I mentioned. Optum is still following, I guess, Pam, what you mentioned had been fixed a couple years ago with speech. So they're still treating the speech with an interim license, I think, similar to what you're saying, Pam, for OT and PT, for the temporary license. Now, the difference, not to make things complicated, but the difference between OT, PT, and speech is that the speech therapists have graduated, they have passed their boards, they have done
Correct.
everything they need to do to function fully on their own. The only reason it's called an interim license is because the state requires them to have a supervisor during that time period, essentially for like mentorship. It's like a built-in mentorship, but we don't have to, the state license doesn't require us to do any direct supervision activities. Their Cs from ASHA are totally different. That's different. It's a separate thing. So I think there's just confusion because the different disciplines are different, and that's frustrating for everybody. So I think Optum is following, thinking, oh, the speech therapists have a temporary license, when that's not true either. So I don't know that that issue for speech has been fully fixed either.
We can clarify each one when we send out some more clarification on these issues.
Okay, sounds good.
Yeah, we met with the cabinet a few years back, because they wanted to pay the CF a lower rate than than the speech therapists that had their Cs, and they did change their mind on that, and they pay them the same reimbursement rate. Because they are different than the temporary OT and PT.
Yeah. And the Cs are like extra, really. I mean, they're not, you don't have to have your Cs to practice. That's the thing. I mean, I guess some facilities require it, but as far as the state goes, you can just have a license. That's what you have to practice. So it's just a lot of letters and it is confusing for everybody. So, and the processes are all different for the different disciplines, but yeah, we need clarification for sure.
Yeah, maybe we can have Justin, we can have a meeting sometime between now and our next TAC meeting that.
Yeah, absolutely. We can have a meeting and we can, maybe have a draft clarification, policy clarification for you guys on the student issue. I think and to clarify a little bit of what we currently do for temporary and interim licensure. Now the temporary licensure question is going to have to, we're going to have to research that and see if that's something that we can change. So that's not going to be immediate. I mean, that's going to be, we're going to take some time with that one. But we can get you all some clarification on policy quickly. So we'll set up a meeting in between TACs and have something in draft for you all to look at and talk about.
Sounds good. And it's not on the agenda, but it's been brought to my attention that Kentucky Medicaid is often still requiring a physician's signature on a plan of care to get an authorization. And I know, Justin, we talked about you were going to educate the reviewers on that.
Yeah, well, we've done that. So if you have specific cases, if you could send those to us, that would be great. So we can. It's hard to. I'm not sure where we're missing, where somebody's been misinformed or what we're missing. So if you can send us specific cases, we can reach out to those individuals and do some education there.
So what our practice has been doing is we send the policy letter that you wrote along with the authorization request. And so
Oh, that's a good idea, but Dale, because we're definitely experiencing it. Is
Right.
anyone else experiencing that they're saying they need a signed plan of care to get the PA?
Right. So since we've been sending those, that policy letter, with them, we haven't any problem. So, is there any other issues, from the TAC members or the public you'd like to discuss? If not, do we have, it doesn't look like we have any recommendations for the MAC. And, so we can, adjourn this meeting, and our next meeting is on Tuesday, September 10th. And unless anyone has some other things they need to discuss.
Make a motion to adjourn, Bill.
Okay, thank you, Renee. We will see you in September.
Bye.
Bye-bye.
Thank you, everyone. Have a good day.